Annika Wells, welcome to the program.
Good to be with you.
So as we saw there, Labor certainly wasn't considering a levy, an aged care levy, before the election. Now you are. What's changed? Why are you now open to the idea?
I think what I've put forward in the Aged Care Task Force this week is that we need to have an honest, responsible and mature discussion about what aged care is going to look like in this country. And if I'm setting up a task force that is going to answer the question of how do we sustainably, equitably fund aged care in Australia moving forward, we need to deliberate on the recommendations to aged care funding that were handed by the Royal Commission.
Which was 2 years ago,
yeah.
And in the years that followed, Labor, as we just saw, was very cool on the idea of a levy. Was that because you had an election to win?
I would say we're still not advocating any particular proposal. What we are saying is that we're opening up a task force, like you said, short, sharp, to deliberate for 6 months on how to move forward. I would say that proposal, along with plenty of others, have been suggested in about 20 years worth of governments not acting on the future of aged care. And now the time is to look at everything that has come before, deliberate and adjudicate.
Well, you're right. This has been talked about for a long time. Many would argue there's a real need to fix the funding of aged care one way or another. You've only been minister for 1 year, and here you are having a crack at this. Why is that? Why have so many been so reluctant to go down this path, and you're now willing to do it?
Well, for me, it's really personal. I spoke at the National Press Club about my mum working in aged care for the last 15 years before she retired. I worked in aged care alongside her for a few years at uni, and I saw then some of the problems that I saw again walking back into facilities at becoming the aged care minister this year. I think this is just one policy area that has been allowed to drift as too hard for decades and decades. And if we can't act after a Royal Commission that had an interim report titled Neglect, genuinely, when are we going to do it?
So the two Royal Commissioners had slightly different views on the best way to do a levy. What do you think? And I suppose, where do we need to start here? Will you tell the task force what funding is needed? Is that important to begin with? How much money is aged care going to require?
I think that would be putting the cart before the horse. I think where we're coming at this from the perspective, how do we lift the standard of care in this country? I said some guiding principles for me chairing the task force are going to be, how do we get better care into the system? How do we get better clarity into the system? Because people tell me every Saturday morning it is almost impenetrable. So a bunch of work for the task force to do, sure, on what the different proposals are and what they'll raise.
But if you need to raise, say, an extra $10 billion a year to deliver the services people want in aged care, well, some options are going to look better than others, right? A levy across the board, all taxpayers, might be where you have to go.
I think what we need out of this is for people to genuinely feel like they have a choice, whether that's a choice to stay at home for as long as possible, whether that's a choice to enter a particular model of residential aged care. I mean, there's some really innovative models out there in other countries starting to come into Australia, but how do I make policy settings that encourage investment and make it an environment that people want to invest in innovative?
So what are those models, those innovative models from overseas that you're talking about?
Yep, so there's kind of the village model, which initiated out of the Netherlands, the Hogweg, apologies for my Dutch model, where it's based around a village. People live in sort of houses that might occupy 6 or 7 people, like it's called a hearth in the Netherlands.
Right.
And then they have a restaurant or a gym or a village green, and they down in Tasmania there's one that uses cargo bikes to get people around, and they speak to much higher visitation rates of residents from their families, because it's an environment that people want to come to, that grandkids don't feel is too institutional.
So is this the future of aged care? Because we've heard you talk about what we don't want to see.
Yeah.
Is this more home style, in between shared accommodation and in-home care? Is that sort of the future you're envisaging?
I hope so. And I think what people have told me is that innovation has been pretty stifled. There's no reward or incentive to do it apart from the goodness of your own heart. And there's other models for people where they've created inside a Main Street, a village environment. It's very similar to the small town it lives in, where the hardware store's in the same place in relation to the grocery store. People have a house front, a porch, and then all of their healthcare practitioners operate through back corridors discreetly, and that creates efficiency as well if you can do that quickly.
I mean, it sounds wonderful, but it does sound expensive. So it gets us back to this issue of how you fund it. Are you open to a Medicare-style levy on all taxpayers?
As chair of the task force, I do think we have a genuine duty to deliberate on the two particular recommendations of the Royal Commission. Whether or not that's to rule them out immediately, I think we owe them the respect of considering them. There are plenty of other proposals out there too. The sector itself called together a summit last week, and they're going to put a white paper up to the task force. Can't wait to read that. So I think it's just too soon.
Is this a way, particularly if you put a levy on higher income earners to pay for this, is this a way of clawing back some of the stage 3 tax cuts benefits that will flow to the top?
That is not my guiding principle setting out to do the task force. But the point that I think the thrust of your question is that Australians are already paying more for aged care at the moment. It's a $34 billion bucket of money in the budget. Taxpayers are contributing huge amount for good reason. We've got to lift the standard of care. We put a $36 billion injection into aged care in the May budget. And on existing settings, because there already is means testing in aged care.
Well, yes, there is, but I wanted to ask you about this too. It seems a bit of a light touch, really. I think at the moment, the government currently takes into account, was it up to $186,000 of property wealth? So if you live in a $4 million house, you get the same subsidy as someone who lives in a very modest flat.
Yeah, and I think that speaks to the reason for a task force to reform aged care funding, because it speaks to the equity
more user
of the
pays
system.
For those who can afford to.
Well, I think we need a system that people feel like they've got a choice about where they go, and if they have the means to pay for it, they can do so.
And should do so?
In the same way that I've made sure in the terms of reference that there is a safety net, so people who do not have means will still have options, choice.
Yeah, options and choice are important, but I guess my question is, will you require those who have wealth to use it?
I think it's too soon to say what the Aged Care Task Force will recommend to government. Okay. But I think what people have told me, my test here is not just what do people come and meet with me in Parliament about aged care proposals. It's also about what people tell me outside the IGA on a Saturday morning in Lily, and they have made very clear to me that they want more options. They're prepared to pay for higher quality care, but they can't find it. So my job is to create the policy settings that allow those things to be built so people can find it.
I want to ask you about some of the workforce challenges. You've said this is the biggest challenge right now in aged care. Now, Labor promised all aged care facilities would have a registered nurse on deck 24/7 from July 1, so just a few weeks from now. You've even made this a legal requirement. But as this deadline approaches, we know some providers are struggling, and they're now being told, look, as long as you can show you're genuinely trying, that's okay. So a simple question, when will this promise be fulfilled?
As soon as I can possibly muster it.
When's that?
David? Well, like you say, workforce shortages are the #1 issue in aged care. That's not new. Like I said at the National Press Club, that was the #1 issue for mum in the early 2000s. And it's also not just us in Australia. We are in global competition for care economy workers. The ageing population is a issue being faced by every single rich country across the globe.
Sure, we've known this for a long time. You guys set this deadline, you made it a key election promise.
Yes.
So when's it going to happen? Could it be another 12 months?
I think it speaks to the seismic shift happening in the sector at the moment. Yes, we legislated it within months of coming to Parliament because we wanted people to understand that we were going to go about aged care differently. And yes, I've admitted for some months we're going to fall short 1 July.
So when is it now looking? Could it be July next year?
Well, what will happen come 1 July when the legislation kicks in and people are required to provide nursing 24/7, and like you say, where people aren't able to do so, they will still have to tell Janet Anderson, our regulator, that they have alternative care arrangements in place, and she will have to be satisfied with those alternative care arrangements.
Okay, but you're reluctant to put any date on when this will now happen?
Yeah, because like you say, it's a systemic, crippling shortage that we inherited, that other countries like us face, but that shouldn't mean that people have to accept a more feeble standard of care and wait. I mean, I'm sure people are watching us from nursing homes this morning, David. We made that promise. I don't regret making that promise because come 1 July, even where we fall short, there will still be many, many more nurses providing many, many more hours of care in nursing homes than there ever would have been had we not done so.
How many foreign workers will be required to meet these commitments, both the nursing requirement and the 200 minutes per resident per day commitment that has to be met by October?
Well, thousands are required. The aged care workforce, as it currently stands, is about 50% migrant workers. So that is the environment that we've all been operating in for some time.
Will that be higher as a result of these changes?
I couldn't speak to whether or not that's likely to be the case, just to say that one of the measures that we've put in place is labour agreements, which is a huge development. No Liberal government could ever have done that.
This is to fast-track more migrants into aged care.
It's a tripartite agreement between business, government and unions. The first one that was signed in Perth a few weeks ago now with Minister Giles has 559 workers coming in across a 5-year agreement.
Some immigration experts are worried this is now the fastest way to get a permanent Australian residency. You can come here, do 6 weeks training, work in aged care for 2 years and you can be a permanent resident, right?
The 6-week training, I'm not sure where that's come from. I think that might speak to that Howard era cooks and hairdressers
How much
model.
training would you need to do?
If you are part of a labour agreement coming here, you have either met your Cert 3 qualifications, which is about a 6-month course, or you have 12 months equivalent experience in order to participate in the first place.
Will the government's same job, same pay rules apply in aged care? Because a lot of labour hire is used in aged care.
Agency is a huge issue in aged care, but these labour agreements are a unique beast. They're a massive deal. Minister Giles tells me, because it's strictly his patch, that he's got people queuing out the door of his office to line these up because they achieve for everybody what they need to do.
They pay $51,000 a year for those migrant workers in aged care.
Depending on the agreement and the award
so again,
and the new 1 July pay rise.
Will it be same job, same pay in aged care?
In the same way that all federal laws apply and the various different awards, that there's 3 that sit under the aged care sector, apply to workers.
So will the migrant workers get the same pay as the Australians?
Yeah, the labour agreements in no way undercut the rigorous labour laws that we have in this country.
The government has now addressed, I think it's 69 recommendations from that Royal Commission. Will the other 79 be implemented, or are there some you now won't proceed with?
There are some that directly contradict one another, like we've already spoken about 2 different proposals about how to reform aged care funding. So it is the case. We're not going to hit 148. They come now really in trenches. So there's sort of another, I want to say, 30, 40 tied up in delivering a new act, which we're hoping to do next year. There's another couple of dozen tied up with delivering a new support at home system. So we will keep working through them, but it is the case that...
One of the recommendations was to review the regulator, the Aged Care Quality and Safety Commission, to assess whether it's doing its job properly. That review's been done. It's been sitting on your desk for, well, since April, as I understand.
6 weeks, I think.
So when will you release that?
So we've had a read of it. Some of those things are attached to what will be decisions of government in forthcoming budgets. So we will release it, and we'll release it with a government response as soon as I can manage.
All right. And look, a final one just on the issue we're going to talk about shortly. Katie Gallagher, she's denied misleading Parliament when she said, and I quote, "No one had any knowledge about the Brittany Higgins rape allegations." She now says, though, she was made aware. How has she not misled Parliament?
Well, she said that on the night, this set of estimates where this all blew up, that she wasn't answering questions as a minister. She was the person asking the questions in the first place. She's had this interaction with Linda Reynolds. They've taken it offline. They've had a discussion about it. They've put that to one another. Linda Reynolds accepted that at the time, and 2 years on, I accept that now.
But she did say no one had any knowledge, and she did.
I think she said yesterday that she was aware of some things and she didn't act on it, and she didn't do anything with that information. And honestly, David, the political conjecture that has gone on this week about this issue, I find pretty horrifying, and failing to see a really awful forest for the trees. Like, these people who are, at this point, fairly craven political operators running around having never concerned themselves with answering public interest questions 1 through 86 about what happened here in their government, to now say, braying with urgency, that we need to answer public interest questions 87 through 88. Totally beyond the pale in my book, particularly when it comes to Katie Gallagher, who not a soul in Parliament has done more for women and the safety of women, either inside or outside the building, than Katie Gallagher.
Annika Wells, thank you for joining us.
Pleasure.